The biggest question that we keep getting is about, what causes brain inflammation? How do stem cells reduce it?
Okay, so I do get asked a lot, what causes brain inflammation? And the short answer is we don't know for sure in many things. So we know that the mother can pass on inflammation while the child is still in the uterus. That it's been shown through epidemiologic studies. There was a 1964 measles outbreak in the United States, and mothers that got the measles had a much more likelihood of having a child with autism. As soon as that was found out, the people in the Scandinavian countries, which have a lot of national health care and they keep very good records, they found out that if the mother was admitted to the hospital in either the first or second trimester with a bacterial infection or a viral infection, the chance of autism went up as well. And in animal models, that's been proven out. If they induce inflammation, peritonitis or other types of inflammation in laboratory animals, that when the offspring are born, they can have signs and symptoms of autism, repetitive behavior, poor socialization, things like that. So that's one way, through utero. So it may not be infection. We know that, obesity is rampant in the United States. Women that are obese, they tend to have more inflammation in their uterus than women who are of more normal weight. So maybe that gets passed. Also, the child can get exposed to inflammation after it's born. A child can get, from meningitis to a viral infection that somehow passes through the blood-brain barrier. Everybody is worried about vaccines, and you can't even say the word, vaccines. I'm not an anti-vaxxer by any stretch, but it should be looked at because, we are giving something that causes inflammation, and we now know that inflammation is one of the root causes of autism. So it makes sense to look at it, and it really hasn't been looked at.
Yeah.
So that's how it is, and most people don't know that inflammation is kind of a hallmark of neurodegenerative disorders: Alzheimer's, Parkinson's disease, multiple sclerosis, cerebral palsy, chronic traumatic encephalopathy. All have inflammation in the brain as one of their problems. And so the whole question is what caused it and why.
So I know you kind of addressed it in the last time we talked, but you said that traumatic brain injury people were looking at stem cells and how to reduce inflammation. What is it specifically that the stem cells do in regards to attacking inflammation?
So the stem cells have the ability to read inflammation and then migrate towards it. There was a great study that was done in rodents just last year, where they induced inflammation in the rat's brain, and then gave it actually human umbilical human umbilical cord blood, and that blood got held up in the liver, lung, and spleen, which are the big filtration organs. But as they followed those along, by about day 8, they started to migrate out and go to the brain. And by day 14, they were all in the brain. So that's how they work, is they migrate. I believe they have the ability to cross the blood-brain barrier. But once they get into the brain, the cells that kind of control inflammation in the brain are called the glial cells. And these glial cells are kind of support cells for the neurons. And they exist in kind of 3 states. One is called the neutral state, or the G0 state. One is called the pro-inflammatory state, which is the G1 state. And pro-inflammatory means secreting enzymes that break down neurons. They take away synapses or connections. They kind of clean up bad things. And then the other state is the G2 state, or the pro-neurorestoration state. And in that state, they secrete factors which make the cells grow, get new connections, make more neurons come in, call in stem cells, things like that. And so what these mesenchymal stem cells and other cells probably as well, they migrate to the brain, they migrate to inflammation, they kind of nestle up to these glial cells, and they work by something called paracrine activity. And what they do is they secrete something called an exosome, and everybody wants to know what an exosome is. An exosome is essentially a packet of information. It's got protein in it, it's got some microscopic RNA in it, but it leaves the stem cell, it fuses with the glial cell, and it releases its contents into it. And those contents then cause the glial cell to change from the G1 to the G2 state. And then the glial cell starts secreting a factor, which is a great factor. It's called brain-derived neurotrophic factor. BDNF is how it's abbreviated. But that is what causes the cells to grow, to make new synapses. There are certain areas in the brain where there's something called neurostem cells live. It causes those neurostem cells to come to the area and you'd start dividing. But that's what they think the mechanism is that the stem cells access the brain, they cuddle up to the glial cell, they secrete an exosome, and then the exosome switches the glial cell from an inflammatory state to a restorative state. And then that glial cell starts to secrete brain-derived neurotrophic factor, along with some other things, which causes the brain to grow, to add new connections, and just be more efficient.
So in a layman's terms, basically the stem cells go in, excrete a chemical,
right?
And then that attracts the neurostem cells, and then they start repairing from that point.
Right. The go-between, though, is the glial cell. So it secretes. That's why everybody's high on exosomes. I'm not too big on exosomes right now because the stem cells design an exosome specifically for that problem. So if you have a heart attack, you get a different exosome than if you have autism. If you have a broken leg, you get a different exosome than you do for autism. So that exosome is very specific. Now the placenta is full of exosomes, and so when people just extract the exosomes and they try to inject it into somebody, nobody knows what those exosomes are actually going to do because they don't know what they were designed for.
Gotcha.
So the little packet of information, the exosome goes to the glial cell. The glial cell switches its machinery to that exosome and then secretes the chemical that causes the brain to change and to grow and to heal.
So it fixes itself.
Exactly. It turns on the mechanism of your own brain to heal itself. Because a lot of people have the misconception that this stem cell goes in and somehow becomes a neuron. It becomes a cell that becomes part of you. It doesn't. In fact, if you look at Neil Reardon, who's kind of the godfather of this, he said that this cell is misnamed. Instead of the mesenchymal stem cell, it should be called the medical signaling cell. Still call it the MSC, but it works by signaling your body to heal itself.
That's amazing. That's amazing. So the next question, because we did this, whenever Lynlee was born, we saved the placenta, we saved all that stuff. Okay, we had it cryogenically frozen. But now we can't use it because I don't want to use the word tainted, but in this case, it's her own stuff. Are you frozen?
I am not. I'm listening.
Okay, sorry, you're sitting very, very still. But can people use, like, if their child has autism and they save the placenta, they save all the cord blood, all the stuff, can they use their own cord blood and placenta, or do they really need to go outside to get something that's, I don't want to say the word infected, but not infected?
Yeah, well, that's a great question. And so it kind of depends, and I hate to give that answer. Theoretically, if the inflammatory process started while the baby was still in utero, then maybe those cells are somewhat, damaged, let's say. But let's say she was born and then had an issue, and the inflammation started that. Because a lot of people say, my kid was normal till 18 months or 2 years, and something happened. Well, that something happened, the cells were already saved.
Okay.
The biggest problem, I think, of a family like yours getting the umbilical cord blood to be used for autism are these cell banks saying, we're not going to release it. Because we've had them tell that to us,
Mhm.
because it's not FDA approved for autism. And they kind of hide behind that shield. Well, my feeling is they're your cells. You're paying for them. You pay them. That would be like the bank saying, we're not going to give your money out of your savings account because we think you shouldn't get a new car. That type of thing. That's not their role. Umbilical cord blood has been used for almost 60 years in medicine. There's 80 different diseases that this stuff can be used for. So it's safe, and there's plenty of literature that shows it's effective. I do believe in time that as the new studies come in and people apply for an IND, which is a new drug, license and stuff, that the paperwork will get done. But the average length of time from discovery to it being state of the art and being incorporated in medical care is about 17 years. And most people don't want to wait 17 years.
Right. That makes sense. So, is there an age limit to have stem cell therapy done for autism?
I don't think so. I lived that when the Duke paper in 2019. I went to Duke, and I know people there. The first thing I did was call Duke and say, sign my kid up. But they said, we only do, 8 and under. Your son is 22 years old. No. And I asked him, well, do you think he wouldn't benefit? And they said, we have no reason to suspect that he would not benefit, but we just do kids. And then I called Panama, and I kind of heard the same thing. They tend to take kids up to 18. But when I read the baseline study, the study out of Johns Hopkins, which is the one that proved these children have neuroinflammation, they had not a child, a man who died, who was autistic, who was 42 years old. And when they looked at his brain, he had brain inflammation. So what this tells me is this neuroinflammation is probably a lifelong phenomenon for our children with autism. So as soon as I figured my son has neuroinflammation, to me, it doesn't matter how old he is, because the cells that he's about to be given, they don't know how old he is. They go in there, they figure out there's neuroinflammation. They migrate to it, they cuddle up to it, they turn his glial cells, from the G1 to G2 state of my son, which is what happened, which is how I'm here, because, my wife and I decided that there are people like us whose children can't get on a plane and go to Panama or Mexico. I have nothing against, especially the Panamanian people. Neil Reardon's a real life researcher. He's the godfather of all this research. But some people just physically can't get their children, on a plane.
Yeah.
But speaking to the age, I believe you would rather want to treat younger more than older. If I could have given my son stem cells at 6 instead of 22, I would have. But the research wasn't there. If a young child, gets trauma or an operation or a brain injury, they always heal much better, than an adult. And so I do believe younger is better. However, autism is being diagnosed younger and younger.
Yeah.
And it's in order to give these cells are bigger than just IV fluid, or even bigger than red blood cells. So you have to get an IV in them that's a big enough caliber that these cells can go through without being damaged. And so, somebody who's 18 months old, that might be difficult. So, I've never done anybody that young. I've done somebody under 3 though. But I think younger is better, but I think probably in the 2 to 3 year range group is probably the best for are set up to get a simple IV in and give it that way.
Yeah. Now, is there anything that say they've signed up, they paid everything, they're coming to see you? Is there anything they need to do, people need to do to prepare for a treatment? Like, should they modify their diet? Should they do diet modification afterwards? Because we want to maximize the results.
Correct.
So
Yeah.
what kind of things?
Well, first of all, as you know, with children like ours, you have to pick your battle. And I believe most parents, if not all parents, who have made it to talk to me are very good parents and want the best for their child. So anything that they can do to cut down on inflammation is good. Diet's a big one. The Duke study, which kind of broke all this, they didn't do anything different except just add stem cells. But if you can cut down on the sugars and the processed foods, that would definitely be good, because these cells, once again, migrate to inflammation. So if there's a lot of gut inflammation and things like that, cells are going to go there in lieu of going to the brain.
Yeah. Okay. That makes sense.
However, we've had plenty of children who have gut inflammation that the parents have been doing everything for, that are 8, 9, 10 years old, still not potty trained, with chronic diarrhea or constipation, who, they called us a week later and said, this is the first normal bowel movement that my child has had.
Mm-hmm.
Because these cells, they're starting to be given for inflammatory bowel disease, like, Crohn's disease and ulcerative colitis.
Really?
So these have the ability to help the gut. And so there's such a gut-brain axis that when you help the gut, you indeed are helping the brain. And so we've had plenty of children that have gotten the therapy and have become potty trained after.
So how often, speaking of therapies, how often do we as parents who are going to be doing this consistently, how often should we do another treatment?
Another good question. In the United States, there's never been a study that has looked at multiple treatments and progression in autism getting better. It's brand new science, like I said, and it's been one treatment. Let's see what happens. But the Duke study showed that these kids continue to improve until 6 months, and then they plateaued. However, they never went back down. And the Duke study also had very objective endpoints, as well as some subjective ones. But they showed that with a single dose, that there were more, brain connections by MRI. The EEG in the speech and language and socialization areas of the brain, improve. That socialization by this kind of measurement of time in an experimental setting improved as well. And that never went back down. And I think that's because the brain made a quantum leap forward. So obviously, if we know the cells stop working at about 6 months, I would think that would be a great time to give another dose. Certainly, that would be my starting point.
Yeah.
But there's only been 3 things that have really been shown to grow new brain cells. One is fasting. The second is significant exercise. And the third is stem cells, umbilical cord blood. And so you are giving your child something that has been shown to grow the brain, make new connections. And so, like for my son, I've given him 6 doses over 5 years. And I've just kind of said, what can I do to make him better? And it's not as dramatic as it was when it first happened, because, it was crazy, as you've seen, because we see some incredible responses. We gave him stem cells, and 2 months later, my niece called me and said, "What's up with Marston?" And I go, "Well, what do you mean?" He goes, "Well, he called me on his cell phone. He's 23 years old. He's never called me on a cell phone before." And we had, a normal conversation about my boyfriend. And so it completely made my son, conversant almost. But I gave him stem cells probably 6 months ago, and 2 months ago, we were out of town. My sister-in-law took him out to dinner, and he used the word relevant in a sentence. And my son still has, some cognitive disability. And that's crazy. Where did he ever use the word relevant before or hear the word relevant? And, he's driving a car, living independently, and he's maintaining a job. And so he's happier than he's ever been. And if you measure life by happiness and not necessarily your experiences, because I know you're sad when you lose a child, but with autism, it's like you lose them every day. You see how far away from normal they're getting. And so, we kind of mourn the fact he didn't go to a regular high school and get the girlfriend and go to homecoming and all that. But I can tell you what, they love him at BJ's Wholesale Club, and he loves going. He likes the fact that, he has a schedule and he can drive a car. He just got a girlfriend. So that's, all moving towards normal. So it's nothing short of amazing, which gives us back to why we offer this therapy, because it should be offered and we shouldn't wait to get, all the studies. A phase 1 studies, it's safe. That's been done. A phase 2 study, does it work? Yeah, that's been done. A phase 3 study is dosage and administration, which figures out how often do you dose them? How much do you give? Do you mix MSCs back with umbilical cord blood? There's all these little nuances that can be figured out. And that's where we're starting to get now. Yeah. But most people don't want to wait the 17 years.
Okay. We'll have a few more minutes. So let me ask 2 last questions. Can you walk us through an appointment whenever someone comes to actually receive the stem cells for the procedure? What does that procedure look like? And then afterwards, are there any precautions to follow?
Okay. Well, I would say, you come into the office, and most of the kids with autism are scared. They've been to doctor's offices before, they get shots, they get their blood drawn. And so we want everybody to know this is like a safe place. If your kid, runs up and down and jumps and screams, that's okay. The good news is, all my employees are long-term. They know my child. They've been through this. Nothing is going to be out of the ordinary. So, you fill out the obligate paperwork. We bring you back to an exam room, and then we just talk. I want to make sure the parents, know what's going to happen. They feel comfortable. It's kind of scary. And then I just talk to them about sedation, and we sedate probably most kids because we don't want this to be traumatic, to the child, to the parents, or to us, frankly. And a quick shot that probably takes less than a second, it doesn't really hurt, will kind of knock the child out in about 5 to 7 minutes. The child is laying there doing fine. We start the IV. We usually pre-treat with a little Benadryl, and then we give the cells. And usually the child wakes up in about 30 to 35 minutes. The IV comes out, and life is good. The precautions are kind of twofold for the stem cells. The first is kind of immunologic. Whenever you get an immunologic agent, whether you get a transfusion of blood or you get stem cells or you get something, low-grade fever or a rash, that's only seen in about 2% of kids. And we haven't even seen it since we've been giving, Benadryl, pre-treatment. Yeah. Those both happen usually within the first 6 hours. If it's a fever, you just simply give Tylenol. If it's a rash, it usually goes away with Benadryl. The others are psychological. And these are kind of nebulous things, but it is, published data, is that increase in hyperactivity and increase in aggressive behavior. These were really only seen in kids with aggressive behavior or ADHD. And they just thought they saw a little bit more of it. It was short-lived. The episodes lasted for about a week and then went away. And so there's really no long-term side effects. There's never, these cells don't cause cancer. They go away after 6 months. And then the only thing that we see sometimes, which happens from time to time, is with the sedation. Sometimes the kids can get a little nauseated. And it's the same mechanism as if you drink too much alcohol. They're not exposed to this type of drug, or, people understand that the biggest risk of surgery is just getting sick from the anesthetic, because it is an anesthetic type agent they get. So we just ask maybe nothing to eat for 2 hours prior, and then, don't promise the kid an ice cream cone and then give it to him right away. Let the child ask for it.
Yeah.
Because he might be a little nauseated and you might be cleaning up the milkshake from the back seat when we could have prevented it. But those are probably the only things.
Okay.
Very, very safe.
Very safe. Okay. And then lastly, you kind of mentioned it right off the top. You said there's a new study coming out from Duke. What are you hoping to see kind of on the forefront with new studies and research?
Well, I think the studies will do two things. They'll reinforce the fact that these cells do work. The last big Duke phase 2 study, though, showed there was no benefit in the overall group, which was very, was mystery to them because all their other studies showed there was a benefit. And what they did with those kids is they were blinded, nobody knew, and it was the worst of the worst. And what they found out was that the vast majority of the children, almost 3/4, had significant intellectual disabilities, IQs in the 60s and below. And most kids with autism don't have intellectual disabilities. And when they separated the kids out that had severe intellectual disabilities and looked at the kids that had IQs of 70 and above, then the majority did get better. So the question is, kids with significant intellectual disabilities, do they need higher dosing? Do they need more doses? Why didn't they get better? And so these new studies are going to look at, are MSCs better than just cord blood? Hopefully did they, mixing some together. There's something called passages, which is a way to let the MSC divide on its own without really stimulating it, which is against the law. Do passages help? There's a lot of questions to be asked. These were smaller studies that were quicker studies to help try to point us in the right direction. But those are some of the questions that need to be asked. Is there anything preoperatively that we can do to pick out the responders versus the non-responders? That way we don't subject parents to, I don't want to say hope, but the money and the expenses of travel, if they know that they're more than likely not going to respond. Even though in the Duke study, they had several kids with profound intellectual disabilities that got better. Just as a group, they didn't, and so, some type of non-invasive way, maybe to study neuroinflammation, in a maybe an objective way to study games. I know Duke has come out with a new laptop, not a laptop, an iPad with a program that kind of records the child's eye movements and stuff like that. And it might be a way to actually follow things along. So these are all kind of cool stuff that's coming out.
That is cool. Anything else that you want to add?
No, it's just that the personal satisfaction is amazing. I'm committed to this. I'm adding an extra day a week. I'm phasing out all operations on Wednesdays. I'm starting to add Fridays. And as this fills up, I'll start, slowing down on Mondays. And I think that this will be my life's work. I really do. I think that, I've been a surgeon a long time. I still love surgery. It will still probably finish out a year or a year and a half or 2 years of surgery, but I don't want to be the surgeon that hangs around too long, and I think that, I can offer this and even in other diseases, cerebral palsy has been shown to be better, some pulmonary diseases have been shown to get better. And so I think that this will be, one of my passions for the rest of my life.